Tom Kotler, please come up. Tom Kotler is with Health Prize Technologies. I'm going to let him tell you what he does, but it certainly goes directly to this issue of motivation. And I want to, when I'm going to come back up in a minute and ask you a few questions about how far beyond what you're currently doing you can take this motivational stuff.
Thanks. So I'm going to start with a little story. In September of 2011, the United Nations General Council held its only second health summit ever. The first one was in response to the HIV/AIDS crisis. But in September of 2011, they didn't respond to a particular epidemic as we know it, but to the crisis of non-communicable chronic diseases. 75% of all US costs go into treating chronic diseases. Most of these diseases are caused by poor human choices and bad behavior. So let me give you some numbers. I have my little crib notes up here. In 2015, we spent $130 billion to treat diabetes in the United States. It's estimated that by 2034, in just 17 years, that number will be $336 billion. By 2060, some have estimated there will be more Chinese diabetics than Americans. Think about that. There'll be more Chinese diabetics suffering from that disease than exist in our country at that time. 370 million Chinese diabetics in the next 40 years. Today, half a century after our first polio vaccine, 40 years after declaring war on cancer, 30 years after a smallpox vaccine, we've killed most of the major devious scourges that have plagued us, and yet, in important and in very expensive ways, we're more unhealthy than previous generations. More unhealthy and less healthy, actually, in many ways. We live longer, but as a general rule, many of us are much less healthy than we used to be. If I were to ask you who quote this was, you might say some New Age guru, but in fact, it was uttered by Hippocrates over 2,400 years ago. Instinctively, we all know what we need to do. Eat well, get some exercise, don't smoke, don't drink too much, take our medicine. Medication non-adherence happens to be a problem many of you may not know anything about, but it is one of the largest problems in all of healthcare. It's responsible for 125,000 deaths a year in the United States, fifth leading cause of death in the United States. It's been estimated by New England Healthcare Institute it's responsible for $290 billion of otherwise avoidable medical spending each year in the United States alone. It is the number one reason, shockingly enough, that transplant patients reject their transplanted organs, not taking their immunosuppressant drugs. Given a second chance at life and someone else's organ is functioning inside your body and you lose it because you don't take your medication. For the pharmaceutical industry, we want to talk about the business side of this. We estimated with Capgemini that the pharmaceutical industry loses $637 billion each year globally and $250 billion in the US alone from patients not taking prescribed medications. And the biggest negative outcome here is at the individual level. Almost everybody I've ever met and talked to about my business, which is a SaaS platform using gamification and behavioral economics concepts to motivate patients to start and stay on their medications. Almost everyone I've met, in fact, my two largest investors actually, sorry about that. My two largest investors actually had friends or family members die from not taking their medications, and that's why they invested. It is an unbelievable problem, but it's not the problem we've always thought it was. We've always assumed it was a problem of cost or forgetfulness, and you hear this all the time. I forgot to take my medications. It costs too much. The same people who say it costs too much pay $150 a month for their cell phone bill and $200 a month for cable and cash to their vet to take care of their family dog, but they won't pay for their copay. It's not a cost problem, it's a value problem, rooted in our mind's biases. Actually, we recognize it as what behavioral economists call present bias, is one of the main reasons patients don't take their meds. I want stuff in the here and now and taking medication to stave off cancer or let me keep my transplanted organ 5 years from now. It just seems too far away for me. There are all kinds of other psychological reasons why we don't take our meds and we don't do the right things for ourselves. but the use of gamification and behavioral economics to actually try and make this stuff a bit more fun and interesting, and at the same time getting in a lot of education so we can see the value of taking our medications really works. We build platforms for life science brands to offer free to patients to motivate them to start and stay on their medications. If you want to get someone to change their habits, because we're not in the behavior change business, because changing people's behavior is not something we actually can do with software, but developing habits we can. If you want to get someone to develop positive habits, you have got to engage with them. On average, and we've had over 800,000 patients run through our programs in diabetes, hypertension, high cholesterol, oncology, acne, psoriasis, dry eye, MS. The average patient logs in 4.6 times a week, spends almost 40 minutes a month on web and mobile with us. And just to give you a sense of that, that's more than twice the monthly average of somebody active on LinkedIn. And our average number of months someone's active in the program is about 10 and a half months, which is actually 6 times longer than for a standard mobile app, a health app. And we have a 70 NPS for those of you who are Net Promoter Score. Engaging patients is critical if you want to change their behavior. What does that lead to? In our programs, that leads to patients staying on therapy at rates higher than anybody's ever moved the bar. This is not a problem we're ever going to solve. It is a problem we've got to move the bar on, along with other problems around choice of what we do as patients or as people or as consumers. The average patient in our program, we average lift and adherence is 52%. We reduce gap days between fills significantly. And what's really fascinating is actually this number, 16.6%. Actually, a sixth of the patients in 4 of our largest programs ever run reinitiated therapy because of our program. Not from seeing a physician, but from joining our program. And on average, they acted like everybody else. That is, those patients who'd been on therapy for years and never gone off. So if you want to engage people to get them to understand the value of something, whether it's not drinking, eating better, exercising, or in this case, staying on therapy, you need to understand the behavioral sciences. Those people, we think, who crack that code will create great value, not just for their businesses and their investors, but for society in general. Thanks.
So you didn't even show us the screens and the games, but who pays for this now? Is it the pharma companies that are basically just trying to get people to take more pills so they make more money? Is that the basics from the economic standpoint right now?
So economically for pharma, obviously, if patients take more medication, pharma makes more money. What I find kind of interesting about the way you start with that comment is...
Oh, it's deliberately aggressive, but
well, I understand.
I have a point.
No, I'm good with that.
I'm trying to make in a minute.
I'm good with that.
Not entirely negative either.
No, I get it, right? It's funny because insurance companies do much of the same stuff. So do healthcare networks, provider networks. They're all for-profit entities. And what's really fascinating to me is we have such a negative view of pharma that was like, oh, they're just trying to sell more pills. Yeah, that's their business. But what they're really in the business of is getting better outcomes. And where the world is going now is that pharma can't just sell pills anymore. They've got to start selling outcomes, and they're starting to have contracts to actually do that, and they're measured on outcomes and not on how many pills they can sell.
I buy that, and that's good you said that. But here's why I asked. Because it's so clear that this could be used for way more: smoking cessation, losing weight, exercising, everything else, right? Presumably, you know, you're a startup, you got a lot of big dreams, right? You haven't been around that long, right, this company?
6, 7 years.
Yeah. So do you think there's other payment mechanisms that you will find over time so that you can offer this tool more broadly in healthcare, or a tool like it?
So there are a lot of companies using a lot of these same kinds of ideas for general wellness. So insurance plans offer these programs to people all the time. So we've really focused on the medication non-adherence problem because it's a really interesting and really unique problem. There's an incredible, unique psychology about taking medication. So we did a paper on this. In fact, we asked people if they'd rather take their meds and 47% they'd rather take out the garbage, and 10% they'd rather get a cavity filled. And while that sounds kind of funny, and it was meant to elicit a chuckle, a British paper 2 years after that survey came out, and 1 in 10 patients with chronic congestive heart failure said they'd rather accept a materially increased risk of immediate death rather than take their daily cardiovascular medication.
Wow.
And nearly 1 in 4 of them said they would give up 2 years of their life not to have to take their daily cardiovascular medication. There is this incredible negative psychology to taking medication.
Well, maybe it's because it makes them feel shitty or something. I mean,
It makes them, Esther gets it, she gets most things. It makes you feel like you're sick. It makes you think of your own mortality. It makes you think you don't control your own life. What's really fascinating is the people who complain about their copays, in many cases, take supplements, often paying more out of pocket for their supplements than they do for their copays. And they never forget to take it. We have a paper coming out on this, and it's fascinating.
Wow.
We interviewed these people, and here's what they said. That medication makes me feel sick, makes me think of my own mortality, and makes me feel old. That supplement, even though I'm pretty sure it's not doing very much, if anything, makes me feel like I'm in control of my own life and I'm being healthy.
this is your experience too, Esther? Yeah.
And that's the psychology of it. And so our focus is on that because of the unique psychology of it. And because if you're taking medication once a week or every day, it gives us a reason to communicate with you really frequently. And the frequency of communication is the way we create value in the mind of the patient.
Okay, good. I saw a hand in a remote part of the room, so we'll take a quick question over there, and then we got to, if it's short, is it short? Okay. We'll do 2.
I just, maybe I missed something, but if the reason they're not taking their medication is because they have a copay, why don't you just eliminate the copay?
Well, my point is that's not why they don't take their medication. Many people say, I can't afford it, but it's a question of affording it versus other things they might pay for. Copays, by the way, are really fascinating. They're great for what's called primary non-adherence, which is getting over and filling your first script. So just give you some numbers. Up to 30% of patients, depending on what the indication is, never fill their first script. Within 90 days, it's called the 90-day cliff, 25 to 50% of patients who do fill their first script unilaterally go off therapy. In the US, somewhere around 55% to 60% of patients with chronic conditions, I mean diabetes, hypertension, high cholesterol, are no longer filling their script after less than 90 days. You can give them drugs for free, and this does move the bar just about that much. In fact, to the value point, we've seen the data, a lot of brands that have copay cards, the best adherent patients are the ones who pay their full copay. Why? Because they value it, right? They're willing to put they put the cash out because they value what the medication does for them.
Okay, we got one more quick question here. Well, maybe yeah, go ahead. What?
That's a great question, Esther. Who here takes on a chronic med and is adherent 100% of the time?
Who's
not? Come on, come on, come on.
That's a fair percentage.
So,
okay.
I'm not going to.
And we got to assume there's a.
I'm not going to call anybody a liar, but that would be the best rate of adherence ever recorded in human history.
Wow.
So congratulations to all of you. You're
We don't
wonderful.
have tons of time. Go ahead.
Real quick.
Real quick.
Okay, you're talking about game.
Identify yourself.
Sorry. You're talking about, whoa.
Oh, Linda.
Hi.
Yeah, go ahead.
You're talking about gamification,
Yep.
and you're talking about a strong resistance to people taking their meds.
Mm-hmm.
So what kind of reward system do you have within the games?
So we don't make games. Gamification isn't a game. Gamification is taking the mechanics of a game that make them so fun and interesting and building them into daily experiences to make them more engaging. So we give points for doing everything on our platform. Those points are redeemable for stuff. That stuff could be a charitable donation, a gift card, actual merchandise, depending on what the company wants it to be. What's really fascinating is this. Only about 40% of the points in our program are ever redeemed. And what's fascinating, we ran a program with one of our biggest customers, and we only had charitable donations and to a limited number of charities. The levels of engagement and lifts and adherence were just slightly lower than one where we had all kinds of cool stuff you could buy and point values twice as high. So what matters is less what you give away, and what matters more is how you give it away.
Okay. We're out of time. Simone is the boss. So unfortunately, we're out of time, but we will have more general discussion later. Thanks so much.
A pleasure. Thank you very much.
Really good.